Health Organization has declared that a fast-spreading new variant of the highly infectious disease Mpox is a global health emergency. It's the second time in 2 years it's been declared as such. The continent's leading health body, the Africa Centers for Disease Control, had already warned it could spiral out of control unless measures are put in place to limit its spread. He is the Director General of the WHO making the announcement.
Today, the emergency committee met and advised me that, in its view, the situation constitutes a public health emergency of international concern. I have accepted that advice.
Our health correspondent Dominic Hughes told us what the announcement from the World Health Organization means.
This is the highest level of alert, really, that the World Health Organization can declare. It's on a par with what they did during the COVID pandemic, for example. Viewers might think back to those rather troubling days. This follows hard on the heels of a similar declaration by Africa's Centre for Disease Control yesterday, which declared this a public health emergency that was continent-wide. Now, the World Health Organization's panel of experts has advised the Director General, as you were saying, that actually this is something that the international community really needs to be aware of. And what it is it's a call to arms, really, to try and mobilize not just medical resources, but political resources as well.
Mpox is spreading. It has spread rapidly in the Democratic Republic of the Congo, is now spreading in parts of Asia and Europe. In Sweden, the first case has been discovered of the new variant of what was called monkeypox, now called Mpox. Yesterday, the World Health Organization declared it to be an outbreak of international concern. Earlier today, Pakistan's health ministry has confirmed at least one case of the virus in a patient who's returned from the UAE, so clearly not directly from Central Africa. Provincial health authorities in Pakistan have reported that they've detected at least 3 cases.
Haroon Toulani is watching the spread of Mpox with dread. He was one of the first patients in Britain to become infected during the last global outbreak of the virus in 2022. It nearly killed him.
That 11 days at the hospital was probably the most devastating times of my life. I've never been in such pain all my life. My whole body was aching. I wasn't able to eat or drink or swallow. From then to now, it triggered some memories in me. I don't want to be that level of sick again in my life.
The variant of Mpox that is spreading right now is, we think, much more infectious than the strain that Haroon contracted in July 2022. We know from our experience with COVID that it's extremely difficult to try and contain these kinds of outbreaks. We know it's already in Europe, spread from Africa, and it's almost inevitable that it will get to the UK.
We have repented.